I know we spent time on healthcare reform. I do want to just touch briefly on how HRAs, HSAs, consumer-driven plans may be treated under the healthcare reform laws. And I think Karen left, and she'd be way more qualified than I would to address this issue. But this HRAs, HSAs, consumer-driven health plans are an incredibly viable, important way to take care of your people. The question becomes, under the PPACA, can we have them? And there's been a lot of talk about that. And I think that the early answer is yes. But with everything with healthcare reform is you're just going to have to keep an eye out for this. I don't want to get too far into this, but under the PPACA, employers will be required to offer at least a basic health plan with an actuarial value of 60%. It's also known as the bronze plan. You've kind of heard of the platinum, gold, silver, bronze. Bronze would be the lowest plan you could offer. Basically, the idea, it's the equivalent of a plan covering 60% of the cost of an employee's health care, with the employee responsible for the remainder. So when the Senate did a study when they were looking at health care back in 2009, 2010, the study suggested that these consumer-driven plans will actually provide around 72% actuarial value, which would make them compliant in theory. So I'm not telling you today that they're going to be necessarily compliant, but I think there's some conversation that they're going to survive, and the point being that they're viable right now, and the hope is that they'll be viable going forward because they're an important tool for employers, because quite frankly, they're the most affordable route for employers to take if they're going to stay in the play or pay game. If they're going to play in the game, this is going to be a great way to go down that path. Okay, so we've talked about plan design. Let's talk about, we've established the importance of the plan design. We've talked about it, but how can we help create our people, help them become savvy consumers in the healthcare world? We're all savvy consumers, but just not in the healthcare world, if you think about it. We've got built-in markets with very transparent prices for everything we do. And I started thinking about all the places we go to get goods, and I thought of Walmart, Amazon.com, Target, Price Chopper, Orbitz, Kayak, Priceline.com. I mean, you think about it, it's just transparency in all the other goods that we get or we buy is there, and we know where to go to get them. But, we have no clue where to go to find out what healthcare costs are. We don't even know what they are, and we don't know where to go to find out that information. So this is the big takeaway point of the day, one of them anyway. And I think you've got to understand that there really is a healthcare marketplace. And until now, you just haven't known where to access it. And we're gonna learn how to do that here in just a second. But there is a distinct market for healthcare services in almost every city or region in this country. And by market, we mean that the price for a specific healthcare service is very different depending upon where you go for treatment or services. So a good case in point, if you have heartburn and you need an upper endoscopy in Kansas City, the cost at one facility may be $544, and another it may be $2,580. And that's a 374% price differential. But do you even know when you get that endoscopy what that thing costs? And I don't think you do. You wouldn't even know where to start. A knee replacement may be $18,000 at one facility and another facility $59,000. That's a 229% price differential. But you, as the patient, never know these prices, and I would venture to guess most doctors don't know. Now, their medical billing people do, but the docs don't usually have any idea what these costs are. So when we talk to employers, almost all of them are just shocked when they learn that where its employee receives treatment could affect its bottom line by $40,000 or more. Case in point, the knee surgery. You may have heard about medical tourism, sending people to India and other countries to get procedures to save money. I would suggest that you could create medical tourism here by just sending somebody down the street. But the key is trying to figure out what street to go to and where that cost information is located. And basically, kind of back up a little bit, the variance in cost is due to the complex and often irrational way hospitals and healthcare facilities contract with insurance companies. And these complex contracts are costing you tens of thousands of dollars. But here's a warning. Your people are going to challenge you on this because, as I said before, we're all conditioned to believe that the more expensive health care is better, and that's simply not true. In fact, better facilities are usually more efficient and can often have the lowest price. Almost no hospital or surgery center can justify higher prices based on objective evidence of superior quality. So what do? I would suggest that you would don't buckle to the pressure and remember some of the principles that we're talking about here today. You need to incentivize your employees to use lower cost health care when possible. And over time, they're going to learn that lower cost care does not mean a decrease in quality, but it will take some time. Okay, so you're wondering where are these prices listed? We're getting there. Is there a Kelly Blue Book of healthcare? Is there an Edmunds.com of healthcare? I don't know. Possibly. Price information is very difficult for the average employee to find because providers' insurance agree not to share it with the public, so it will not become available to its competition. And that's been a long-standing way of doing business in the healthcare world. There is a huge lawsuit actually pending in North Carolina against the North Carolina Blues right now over that issue. Basically, will probably help decide some of this, probably will help ultimately in trying to create more transparency if the government prevails on that. But while carriers and providers are still years from providing true cost transparency, third-party medical homes like Compass Health Services have databases of over 20 million claim pricing points for all types of procedures in your city or region. So basically, there are companies now that are buying information, and they're buying enormous amounts of claim data. And this stuff's been cataloged for years and years and years, but never really been used. It's been used in a lot of different ways, but not in a way to help us understand as consumers what stuff costs. It's been used to kind of help price Medicare and Medicaid costs, but not for us as the normal consumers. But it's available now. And history has shown that if you follow this transparency path, you can expect to save over $625 per employee per year on your health plan costs. So if you make this data available to your people, you will save $625 per employee per year on your health care costs. And I'm going to show you an example how this works. You can see that. But let me give you a little example about this. And I'm using medical home kind of loosely. Medical home has lots of different definitions, but I'm going to call this a medical home concept that you can help your employee, Mr. Smith, okay? Mr. Smith needs a knee replacement. His employer uses a third-party medical home to help its employees become savvy consumers. Mr. Smith sends an email to his customer service rep at the medical home outlining the procedure, the doctor, and the facility. The medical home reviews his health plan and its pricing database and compiles pricing information for Mr. Smith for his procedure. Now, this is a really amazing email, and think about this when I'm reading this thing if you've ever got this kind of information before. Dear Mr. Smith, we researched the facilities where your two preferred doctors perform knee replacement surgery. Below is the cost comparison for the surgery at the hospital, appointments, and other associated charges. Both St. Ringo Hospital and St. George Hospital perform a significant number of procedures each year. However, St. Ringo is the newer facility with updated facilities and operating rooms. And if you take some time to look at this exhibit, you'll see that St. Ringo's total cost for this knee replacement is $22,000, whereas St. George is going to charge you $36,700. It goes on to say, one of the most expensive parts of a knee replacement is the implant. While the implant is typically provided by the hospital and included in the hospital bill, physicians will sometimes order these at cost for patients, which are almost always cheaper than having the implant provided by the hospital. This practice in part explains the difference in cost between St. Ringo and St. George. Okay, the email continues. Our data also suggests the physicians you requested are on similar contracts, which have estimated cost as follows. And you'll look at this exhibit and you'll see that Dr. Feelgood is going to cost him about $2,500 to perform the surgery, and Dr. Strangelove charges $2,900, $400 difference. So, as you can imagine, Mr. Smith is now armed with incredibly powerful cost information that he's never had access before to, that none of us really get access to. And he is no longer confused, but he's empowered to make an informed decision. And the great thing is, as well, is that you, the employer, you have now incentivized Mr. Smith to make a savvy economic decision that just saved you $14,000. Okay, the same concept is true for prescription drugs, and quite frankly, just as important. And we know this as patients. We know the prescribing habits of most physicians are not rooted in cost effectiveness. Basically, they get their pad out and they issue or scribble a little prescription for you, and you just take it and you go have it filled without really any true understanding of what the true costs of those drugs are. So what do you do about that? I think you've got to provide your people the same kind of information, and that's prescription drug cost information. I'm going to show you kind of how that would work in this scenario as well. So Mr. Smith, who just endured his knee replacement and saved you $14,000 by using this cost information, now goes to Dr. Strange, or actually Dr. Feelgood this time. And he complains to Dr. Feelgood that he's overweight, he's depressed, and he has heartburn because he loves chicken wings and he loves gin martinis. Okay? And believe it or not, this is if you look at the medical information, it's a very common trio, the trifecta here. So Dr. Feelgood prescribes Lipitor for high cholesterol, Effexor for depression, and Protonix for heartburn. And so like most patients, Mr. Smith is unaware that there are a bunch of alternatives to all these drugs. And but he does remember that you've got a new medical home at open enrollment that you talked about that he could go to in the event that he needed help understanding any kind of issues related to his health care. And so he calls his medical home rep, and it turns out that there are generics and clinical alternatives that are available to him that would save $4,000 on an annual basis. Okay? So the medical home rep calls the doctor's office on Mr. Smith's behalf and suggests that there are some alternatives, and would the doctor be willing to let Mr. Smith try these alternatives? And the doctor agrees. And ultimately, he changes his prescriptions and then saves $4,000 for the group. Pretty powerful stuff. So, kind of moved on to another little principle number 4, and that is you have to provide your employees with interactive tools to navigate the system. And that previous one I just talked about, that's a pretty interactive tool to help your people. In fact, that's someone acting as a liaison for your employee, to help them get a better result. Navigating healthcare is complex and confusing. Doctors and hospitals are paid on a transaction basis where the economic incentives motivate a revolving door approach to care, one patient in, one patient out. The patient is unequipped to protect his interests, let alone understand the care being provided and the related costs. So I would suggest you've got to provide a medical home, and it must include these services. We've talked about cost and quality guidance, help with doctor selection, explanation of care options, scheduling appointments, and help with obtaining medical records and reviewing bills. If you provide this type of medical home, your employees will get better care for less money, no question. So the next question is, well, she says here, but my doctor recommended him. And I think one of the issues where employees struggle is where to go for care. And one of the things that medical homes, like the concept we're talking about, can do is make recommendations, as opposed to relying upon your neighbor or even relying upon another doctor's advice. What does a quality check from a medical home look like when they start looking at physicians? Basically, what they'll do is they'll tell you, and it'll combine the cost comparison with quality of service data. It will ensure that a physician is board certified, associated with reputable hospitals, and not part of a pending or adverse malpractice lawsuit. It's pretty critical information to know before you head into an office visit. And it also encourages employees to go beyond these baseline checks to understand referral patterns, past customer experiences, and even personality fit. I mean, things that we've never ever think about when we're trying to choose a physician. Okay, so we're getting there. We're almost there. Given the complexity of the healthcare system, it's almost impossible for employees to possess the expertise needed to gain the most value from a healthcare experience. Expert support to navigate the healthcare system is essential to cost effectiveness of benefit plans, from finding high-value doctors to identifying surgery centers and hospitals that meet the cost and quality demands of employees. Each step is guesswork without expert guidance. Think about it in your own world. I mean, how many times have you just kind of stumbled through the process and gone where they've told you to go? You need a partner with a third party that has a team of healthcare insiders to support employees with personalized step-by-step guidance. The guidance we've talked about that Mr. Smith got in this process. You don't just want a website with data. Your people need live healthcare experts to coordinate care and problem solve. While the healthcare industry has talked about transparency, the availability of quality and pricing information to the consumer has proved to be difficult. And we've talked about today why that is. Basically, the information is protected as a trade secret. Numerous companies, though, have broken through this historic barrier with knowledge of provider contracting and access to hundreds of millions of actual medical claim costs. With this data and the ability to interpret it, these companies can compare actual reimbursement rates between providers, like we've talked about today. This is the essential link to the healthcare value chain. When exposed, the true inefficiency of the network contracting model in the healthcare industry becomes a tremendous opportunity, really, for you as an employer to control your costs. So here we are. We now are released. We've now learned true cost transparency, how to get there. Simple cost-conscious healthcare decisions have a significant effect on overall healthcare utilization. The key to unleashing the savings opportunity is enabling employees to act on those cost comparison information data points. If you create the path, your healthcare spend will be reduced by at least 10% and $625 per employee per year. So if you're a 500-person, 500-employee company, you're talking about $300,000 on an annual basis, which is just a tremendous amount of money. But I would suggest just as important is your employees and their families will appreciate what your efforts and will become healthy and savvy consumers. So we're back to kind of where we started, and my job today was to try to convince you that there is a way, there is a path, and we'll find out if you believe that. We won't have an actual ballot cast, but my hope is anyway that this has been informative. I'm happy to answer any questions that you may have. I appreciate the opportunity to chat with you.